Acting Speaker, I move that this House expresses its grave concern about the medical crisis in country Western Australia and the lack of resources and priority for country health. This is a very, and before I go any further, that was a significant bill that's just been read into the House by the Minister for Health, and I echo the Minister's comments that I hope that this House and the Legislative Council in its deliberations do conduct it in a way that befits such a serious matter and one that so many of our communities are watching closely and anticipating proper debate on something that affects so many people. So it was a momentous occasion, Minister. Moving from one serious concern to another, we have some serious concerns, Acting Speaker, in relation to the state of country health, and my colleagues and I have been watching carefully since we've come to opposition, making sure that the infrastructure and investment into regional health services made over the last Liberal National Government's period of government has been upheld, and that investment continued. And unfortunately for us, we start to see some of this flagging away because the government's priorities seem to be being directed elsewhere. It's interesting from our perspective that back in 2010, when the House was flipped and this now Minister for Health was sitting over this side of the House, he read with his Premier, the now Premier, the then Leader of the Opposition, an identical motion into the House and brought that to this House, saying that the Liberal National Government was failing in their efforts to invest in regional health. Now, that was in 2010. We came to government at the end of 2008. We'd been in government for a year, and so we're about the same mark in terms of where this government is at in terms of its investment profile. Going on from that investment that raising of concerns in 2010, our government, and particularly in regional Western Australia, but without doubt in the metropolitan area, when you look at the health infrastructure that was built over the last 8 years, made a significant investment in health services and infrastructure. And royalties for regions and the Department of Health, WA Country Health Services, was substantially changed under our leadership to deliver, I think, more modern and appropriate health services for regional Western Australians. It transitioned a lot of our communities that had very old infrastructure into a newer model of care, started to transform some of those workforce challenges that we were experiencing. Now, that's not to say that there weren't some growing pains along the way, and I'm sure the member for Moore will talk about the fact that he's got much younger communities in his electorate and some serious growing pains in the southern and northern part of that electorate along the coast, and that there's some unique issues that we were dealing with in the remote areas of the state as well. But it is fact that we spent a significant amount of money on regional health in government. Now, the Shadow Minister for Health, the now Minister for Health, sorry, the then Shadow Minister for Health, made the point when they brought this debate back in September 2010 that, and I'm directly quoting, when a government makes a decision about where it spends its money, it sends a message to the community about its priorities, Acting Speaker. He went on to say that the WA Country Health Service is struggling to meet the demand and is failing to meet the expectations of the community it serves. People expect that when they go into an emergency department, they will be looked after with the best possible medical care that our state can afford. We expect that a loved one, a child, friend or relative who is taken to an emergency department will receive the best possible care available. Now, fast forward to 2009, and the care and concern shown during that debate seems to have evaporated when we actually analyse some of the data, the information around workforce, the investment into regional health under this Labor-McGowan government. It is not my opinion that this concern has dissipated from the Minister for Health. It is fact, because we see our communities starting to really grapple with the effects of a lack of investment and ongoing commitment to regional health. There has been 2.5 years of this Labor-McGowan government, And I'm sure that there will be initiatives that they point to. We heard some of them in question time in relation to their focus. But I would have to say that a majority of the things that this minister has either signed off on, celebrated or point to as achievements are vestiges of the investment that the previous Liberal National Government made, particularly in regional Western Australia. So in our time, we directed millions into turning the tide of a broken and ailing health system in our regions, and every single member of the every single person in regional Western Australia that was around during the previous Labor government's reign will forever be reminded and remember the then Minister for Health's comments, Jim McGuinty, that services like the RFDS were nothing more than an interest group. That set the tone for the type of investment and attention that that the community was getting under that Labor government. Now, we spent money on telehealth, we increased the funds available to PATS, we upgraded hospitals from Karratha to Albany, and it's not just the shiny new bits, we did the hard bits too. I had 2 shut, and they're both in my electorate. We shut 2 hospitals in my electorate, but we replaced them with new primary health services. I sat with those communities and walked them through the opportunity that we were presenting for them to modernise their health facilities and better tailor the services that the WA Country Health Service could deliver into their community, instead of trying to maintain an outdated and old hospital system where all of the funding was going into managing the old laundry and the old surgery and the old morgue, rather than into the health services and the people that run the services to go out and deal with the issues that the community were experiencing, that primary health care initiative that was so very important. We put incentives for doctors to attract them into hard-to-staff locations, particularly throughout the wheat belt. And we actually, as I just said, provided additional primary healthcare workers, which I think are the backbone of our medical system and our health system, because we need to focus more on keeping people out of the acute end, the expensive end of our health system, and make sure that they are understanding and managing their own health in their own homes. And that's what primary healthcare workers do. Unfortunately, one of the things that this government has ceased to fund, and so all of those individuals that were funded under royalties for regions that had been partnered with by R4R and WACS and other community organisations are no longer employed in those areas. So I asked the Minister what his record is. What is the government's commitment to our country health system? Because I travelled the state with my colleagues and we see communities asking for answers and searching for support, Acting Speaker. We have, and it was the member for Roe will speak about it, I'm sure, in his contribution, held forums in a number of communities where we've invited all the key stakeholders and community members to come together and talk about some of the issues in their communities that are impacting their ability to access quality health care. And I think we start to see our communities questioning this government's priorities, as we have done since we've come to opposition, because they do see record amounts being invested into Metropolitan Rail, but they don't have a doctor in their town. They see $120 million committed to a new marina in Ocean Reef, but we have stories like the very unnecessary and tragic situation where an 84-year-old grandmother was forced to spend 2 hours lying on the floor in the Geraldton Hospital emergency department because there were no beds. And they see the Premier sink $30 million into the East Perth Power Station, but we have ambulance volunteers in every town that we've visited across the state, stretched to absolute breaking point because of ramping in both metropolitan and regional hospitals at all-time highs and non-urgent patient transfers becoming more and more regular. That is not what you sign up to do when you become a St John's ambulance volunteer in regional WA. You are there to serve the community, to support those that are require support in an emergency service, but more and more of these services, less and less people, are being asked to manage these inter-hospital transfers. They see an arrogant Premier and his cabinet who have gutted royalties for regions. They have dismantled the Department of Regional Development and the Development Commission network and caused so much distress for the public servants in that particular department that they now have psychologists and counselling support services going to all of those departments throughout regional Western Australia because of the changes and the stress that has been caused as a part of the machinery of government change. They have attacked our community resource centres network, they've attacked regional and remote education, and they are dragging their heels on animal activists and criminals that are attacking our agricultural sector and the communities that support them. They draw the logical conclusion, Acting Speaker, that they don't matter in the eyes of this Labor government. That's what they believe. That's what they feed back to us when we are in our communities, that this government doesn't care about them. So today we're going to outline why we believe the McGowan Labor government has got its priorities wrong, and as a result, why our country health system is failing our regional communities and families that rely on it. It's not a failure, Acting Speaker, of the individuals within the health system. There are so many committed and experienced and hard-working people who go above and beyond to make this system work. And I want to emphasise this in all of the debates that we have, that we are never criticising the individuals that are committed to those. And the reason that they are committed in this system is because they live in the regions that they serve, and it's their families that have to access those health services. So they want the system to work, but the system can't work properly if it's starved of funds, if there isn't the correct policy or direction coming from the minister and the government, if they are understaffed, if there are gaps in the continuum of the care that a patient requires. The ripples that go right through that pathway for a patient are extraordinary, and it puts enormous pressure on the volunteers, on the family, on the community and external providers if our government system is not doing the job it's supposed to. Pressure mounts on our GPs, our emergency departments, and that is a very expensive model to work to when we've talked about the fact that primary health care needs to be supported in our communities. There are also significant issues in relation to accessing palliative care services, and whilst I appreciate what the Minister has said, that we are not talking about an either-or situation, and I certainly concur with that, we do need to be cognisant of the fact that as we embark on this debate in relation to voluntary assisted dying, there is a renewed consciousness and community desire to understand more about palliative care and the fact that there is significant gaps, particularly in regional Western Australia, for people to access that. I simply don't think that many people understand what services are available or what they are missing out on by not being able to access palliative care specialists when they get to that point in their life. That is not because there isn't a desire to provide that safe and secure and comfort at end of life from our regional communities, but having access to essentially, I liken it when I'm having the discussion with my communities, is you have a diagnosis of cancer, you go to an oncologist. When you reach this stage of your life, you go to a specialist that is trained in managing the end-of-life needs. And there are not that many of them, and it's certainly very difficult for you to access them in regional Western Australia. So we'll talk about the gaps today that we see, and we'll talk about the lack of funding and where we see the lack of leadership creating some very poor outcomes for regional Western Australians. The first one that I'd like to touch on, Acting Speaker, is the workforce gaps that we see. There is a significant GP shortage across the state, and as I mentioned, the member from Barrow will go into more detail in relation to the shortages he sees in his area. But from last count, we understand that there are 15 GP vacancies at the moment across the Great Southern region alone. And Minister, I have also raised concerns with you directly in this place and also through your office in relation to the doctor shortages that we experience at the Merredin Hospital, and we have a number of other shires that have vacancies across the wheatbelt in my electorate that are proving very difficult to fill. Now, I realise that there is some federal interaction on that issue that we need to acknowledge, and certainly we are doing our best at the other end to try and address some of the changes that have been made that makes it very difficult for us to attract doctors, but there are some state levers that can be pulled, and when we start to see numbers like 15, we start to see FIFO workforce coming in and out of Kalgoorlie, we start to see the fact that we have no doctors at all in a community like Denham. So we're talking about Shark Bay, one of the state's tourist hotspots that can have up to 10,000 visitors in the peak season, but no doctor. Can you imagine all of the grey nomads from the speakers electorate trundle their way up to the sun in the northern part of the electorate, and there are no doctors up there. It puts an enormous amount of pressure on the pharmacists and the community to manage that influx. And there are other communities like that right around the state, like the Bremer Bays of the world, I presume, who struggle with a nursing post and then see an enormous influx at the summertime. I would also like to talk about shortages in the nursing posts, so workforce shortages in nursing posts. The member for North West Central continues to raise concerns about the lack of staffing at nursing posts in the Murchison area. So we have Yalgoo, Mount Magnet, Kew, all nursing posts staffed by a single nurse. And when that nurse is called away, either with the ambulance to deal with an issue or an incident in that community, and they need to be transferred out to another larger centre, that community is then left exposed because there is no one at the nursing post. Set aside the fact that if you are a single nurse in one of these remote locations, there are security issues not only for you but for the patients that come in, and I don't think that's acceptable in any workplace, that we are putting people under extraordinary duress, probably under extended periods of overtime and workload and fatigue management come into it. And I think this should be a priority to address these single-person nursing stations in some of the most remote and far-flung areas of the state. And we've touched on it today, but there were comments in relation to the fact that we have FIFO staff now coming into the Kalgoorlie Health Campus, and I'm sure being paid by WACS at great expense to the taxpayers to fill the gaps that we require at that very busy regional centre. There were 12 of these FIFO staff as at the beginning of this month flying in to conduct their roles. I don't think that's acceptable. We need to be doing far more to skill up a local workforce, putting in place training and incentives to make sure that we've got people that want to live in these communities, because Kalgoorlie is a fabulous place to live, Acting Speaker, a fantastic place to live. Well, Minister, it brings me to the next one, which we have raised with you also, is in relation to midwives. And now I'm not pretending that this is a cut and dried issue, but because it requires more than just the midwife, and when we talk about having babies, we need to make sure that we're putting the child's health and the mother's health always at the centre of the medical model. But under questioning from our health spokesperson, the Honourable Martin Aldridge, we revealed that the government had been unable to attract a single midwife to major regional centres of Esperance, Carnarvon, Narrogin and Kununurra for over 12 months. This is from May this year back to May the previous year, despite the fact that there had been 10 positions being advertised in those locations alone. The Kimberley, member for Kimberley, was one of the hardest hit regions, with midwife positions at Derby, Halls Creek and Fitzroy Crossing hospitals all remaining vacant. Our health spokesperson, the Honourable Martin Aldridge, raised these concerns. He raised them directly with the Minister. We've asked for a solution as to how the government is planning to reverse this trend, and I look forward to the Minister's response on this, because our advocacy for the people that would like to be able to have their babies closer to home is not going to go away. The data is very challenging. From May to May 2018-19, the state advertised for 55.6 FTE positions, with more than 25 positions not filled. And that was largely, according to WACS, because there are no suitable applicants applying, or the position that was being advertised was not attractive enough to pull someone into that role, Acting Speaker. So we do say that the government has dropped the ball on this, especially on midwifery, because we want to know what the government's investment into training and upskilling our regional nurses, and there is a significant number of them out there, to fill that gap, to create positions that allow those midwives, those nurses to step into more multitasking roles, or indeed to specialise and provide those services right across an entire region. where are the incentives to get these midwives into regional centres where they're desperately needed? Minister, I have spoken to you about it, and you were encouraging at the beginning of the conversation, but I understand that it has now been abandoned, that the Geraldton University Centre put a proposal to government to actually try and train up midwives in the region to fill some of the gaps, those gaps. And the proposal, Minister, was that the spokesperson for health, the national spokesperson for health, he was contacted at the beginning of this year by the Geraldton University Centre, that's in his electorate of the agricultural region, and they were looking for a letter of support from him for a proposal to commence WA's first regionally based postgraduate midwifery course. And the proposal was that that based on the fact that GUC understood that from the June quarter 2017 labour market research for WA, only 57% of regional midwifery vacancies were filled because of low applicant numbers, as well as the lack of regional contextual experience from these applicants. So working together with WACS and the Health Department on an innovative regionally based solution, GUC, Geraldton University Centre, and USQ, the University of Southern Queensland, could potentially provide a solution to regional midwifery resourcing, training and educating regional nurses to become regionally based midwives. Now, slightly strange that you're going to have a partnership with a university that's on the other side of the nation, because I would have thought there was a couple that probably wanted to jump on in there, but my experience, Minister, and I'm not sure about yours, is that some of our universities say all the right things when they want to have a regional footprint, but are actually a little bit lacking on just a tad lacking on commitment after the fact, and I've been a little bit burnt in my electorate by some of them. In Muresk, I know in Kalgoorlie, School of Mines is the same, and the Geraldton University Centre was born out of that very frustration. They are a very good model.
I think there was about 3 local universities involved in the Geraldton University model centre in the beginning, and then they all seem to have
So all of the universities identify an opportunity when there's funding available or when they're currying favour with governments that say you must do more to educate regional people, and then when it gets too hard and the funding model doesn't support them, they retreat back to the suburbs from whence they came in the metropolitan area, and we in the regions are left to fend for ourselves, and that's been my experience. Very disappointing.
Yeah, I thought Darwin was involved in GUC
yeah, well,
as well.
GUC's had far more success in partnering with online delivery courses from other universities in open source, and they provide and we provided some funding for them through Royalties for Regions to provide the face-to-face support on the ground for the students, but the actual curriculum was designed by identifying what the skill needs were for the region, and then going and finding the best course and offering it, and then wrapping the support around the student. It's now a model that's being rolled out and funded by the feds in other areas of the state. There's one in the Pilbara, and there's certainly others in the eastern states. So it's a very good model, but they've got a great plan.
It's a good setup, and I've been there a number of times, member, and it's a good energy in there, and talk to the nursing students there, and it's they're a great cohort.
So their midwifery proposal, which we'd put and it had been put to the government, I think from the latest advice I've had, has been abandoned because WACS and the Department of Health is saying that they don't want to disrupt the relationship that they have with Perth universities that are already training their midwives. I find that unacceptable, Minister.
I'll talk about that in my reply, but you're right to raise the issue, member.
It's very concerning to us when there's such significant gaps in the community, and something that I think so many people raise with us as we travel around the state, and no doubt you. And we should all be striving to make sure that mums and dads can have their kids closer to home, because the cost for that family when they have to leave, and one of my best friends, and no doubt many of the regional members that come from more remote areas, and not even that remote. I mean, I've got people in my electorate which is drivable from Southern Cross. They find themselves spending weeks, sometimes up to months, living in Perth, either with friends and family, or they're having to rent because they need to be near the hospital that they're going to deliver their child in, because they don't have those services in their local town. Now, the primary healthcare workers that I referenced before, Minister, we had quite a significant program under the Southern Inland Health Initiative, and I think you would be very well aware, Minister, that the Sustainable Health Review recommends that 5% of the health budget should be spent on preventable health initiatives. And under questioning during estimates, our health spokesperson, the Honourable Martin Aldridge, revealed that actually the number that this government is investing is 1.7% on primary healthcare initiatives. So that's a concerning gap in terms of where we all know the investment should be. We know that the hospitals are the most expensive part of our health system. If you're investing in that front end where you're dealing with primary healthcare, Acting Speaker, then you are keeping people healthier for longer and out of that acute end of the system. There are no my understanding is there's no ongoing funding for the positions that had been built up as a part of that Southern Inland Health Initiative and then expanded into the northwest and potentially in other areas of the state. And very, very disappointing that we're just falling back to that acute care model. Those positions were supporting the transitions we'd made in the two communities, Pingelly and Cunderdin, where we'd shut the hospital and set up the primary healthcare model, the primary healthcare centre, and shifted all of the staff into the community rather than focused on providing wards and beds. So still an emergency department. I have to say there's probably some speed bumps that those communities have encountered across the way, but our government was very committed to making those models work because we saw them as the future for some of those smaller communities that do have outdated facilities, certainly from a health outcome but also from a financial outcome. And it would behove this government to make sure that they are wrapping every support mechanism around Pingelly and Cunderdin to make that work, because other communities will look to them and say, well, we're not interested in entertaining a model like that because look what happened to those towns. There is an opportunity to get that right, and I know in Cunderdin that they're having some challenges around their agreement with WACS and the palliative care agreements that were made at the very beginning of that process, Minister, but I will follow that up with you at a later date. The other issue that I wanted to touch on was in relation to urgent care clinics. Now, Minister, we've raised this a number of times in this place. You've neatly sidestepped the question as to when we will see one, and this was, and I don't think it was a bit of a side shoe. What do they call it? Soft shoe shuffle.
Soft shoe.
I shouldn't have tried to say that at this point in time of the day, but this was a Labor commitment, so I don't think that we were being particularly tough in asking whether or not you were going to hold yourself to account to your own commitment. But we find ourselves in the middle of the worst flu season that Western Australia has experienced in many years, perhaps the entirety of the state's history. And we start to wonder whether it was just a brash election promise by the Labor government and whether or not we will actually see them. Because 2.5 years in, there really isn't any sign of this policy hitting the ground. And as I said, we've asked you a couple of times in this place as to whether or not you will deliver on the promise to the people of regional Western Australia. And I suspect that we'll probably get a similar answer today, but I will ask again, because my understanding as we do more digging and speak to more people in the community, and these were the communities of Geraldton, Albany, Bunbury, the Pilbara, the Kimberley and Kalgoorlie, and I think they deserve to know whether or not they're going to have these services as promised in their communities. And I wonder, Minister, whether or not it was your original plan for the government to build these clinics near hospitals and staff them and direct those non-urgent patients from the ED to the clinic. So it was, my understanding is that it was originally a government initiative, that the government would fund this and that they would manage it. I think now that has come a little bit undone because there was some pushback from the AMA and private providers that they would be impinging on their ability to run their businesses, although I have to say that most businesses in regional Western Australia are probably at capacity, but they did see it as an impingement on their ability to offer services. And so now I think there's a bit of rethinking happening within the department, and I'm happy to be corrected so that we have a clearer picture about where we're at on these urgent care clinics, that we're going to solve all of the challenges that we are currently stuck in the middle of. And that there is consultation occurring now and in the effort to encourage local GPs to become the urgent care clinic. I don't know that there's any spare capacity in some of these clinics in regional Western Australia. Most of them have quite significant wait times, and certainly when I speak to my friends, colleagues and communities across regional Western Australia, they talk more of having to wait days and perhaps weeks to get an appointment for something that is sometimes quite urgent and end up then in the ED. So I'm not sure that that particular plan is working out very well. So are these urgent care clinics doomed? Have we hit a challenge that is insurmountable because it wasn't a particularly well thought out election promise and is proving more difficult, or is there just no desire to actually deliver on it? So, and I'm very happy to be proven wrong because, I mean, we see, so one of the things I want to talk about next is the ambulance ramping issue, and the Shadow Minister for Health will no doubt talk about ambulance ramping from a metropolitan perspective, potentially, in his contribution. Maybe not, I don't know, but it's been an issue.
It's a very regionally focused motion.
It is, but I'm about to tell you why it's important, because we have people telling us, our volunteer ambulance services, saying that they are now being impacted by ambulance ramping in the metropolitan area because many of our patients end up in metro hospitals. And so when you are a volunteer and you've picked up a patient, and let's say you're in Southern Cross, so you come from Southern Cross, they say go to Merredin. Merredin says no, we can't because we've got no doctors, Minister, we've got no doctors, so you have to keep going. Shoot on through to Northern. No, you're now in such a critical state that you need to go to Midland. No, Midland's ramping, so off you go into Royal Perth. So you've done Southern Cross into, over a period of time, into the city centre. You're a volunteer crew, you're facing a 4 or 5 hour drive on the way back, your community is left exposed because you are not in it, and there are not that many of them. And actually, somebody said to me the other day that if they are released from the hospital and they're the nearest ambulance and they're still in the metro area, they get directed to pick that up as well. And they're volunteers, Minister. So these are some of the issues that the metropolitan ramping issues are causing for our regional communities, and they have been raised in forums that we've held around the state. Now, I understand that there has been reviews of the St John's Ambulance contract with WA Country Health, and there's recently been another Auditor General's report following up on the 2013 report. And I think from my perspective, there isn't one community where I visit that they do not raise, i.e. the volunteers, the sustainability of their service and the pressure that they are under. It came to us that there are daily ramping figures, I think, Minister, and you can clarify this for me, for metropolitan hospitals, but we don't see them for regional hospitals. And what we're starting to see also is some of our services... So metro ones are provided, but you think regional ones are?
No. I would have thought you're right.
Yes,
that we don't do.
So the challenge is we're now starting to see, and this was raised in and around the Geraldton area, some of the services that surround the Geraldton area, they're coming into places like Geraldton and they're seeing ramping, and that's impacting them as well. So it would be good if we could have some transparency in the data for the regional hospitals the same way as we see the metropolitan data, but also that there needs to be a commitment to dealing with that very concerning issue, because if we lose our ambulance volunteers because we burn them out, then regional Western Australia will be lost, and the state will be up for a far bigger budget in their health system than they currently have. They are invaluable and they are doing it for the right reasons, but they are under an extraordinary amount of pressure, and every single one of the members that represent regional electorates in this place will attest to that. The last thing I wanted to mention before I finish up, Minister, was in relation to the palliative care issues. Now, we have been meeting with representatives as we travel around the state, obviously in anticipation that this debate will raise some of those concerns, and clearly that's how some are positioning themselves in this debate. Now, we've got members that would very much like more clarity from the government about, one, how regional people will be able to access what's being proposed through the voluntary assisted dying legislation. I think that's something that we will be delving into in great depth, because whatever new system we put in place needs to offer a quality and equity of service, and that is very difficult in a state this big. But that's a new system that we're introducing, as you said during the second reading speech that we've just heard. We've got an old system, one that currently exists in terms of palliative care, which is far from providing the services that I think most families, when they come to this point in their life, would say is is acceptable. I know that this is not just a regional issue. My own father passed away in the Perth metropolitan area in a private hospital, and the palliative care that he got access to was far from what I would consider appropriate or adequate, and that was very distressing for us. I can only imagine what it's like if you are in a very remote community, or you are like my grandparents or others that would like very much to die in their local community, in their own home, in their own local hospital, or surrounded by their friends and family. To come to Perth, whilst it sounds a bit twee and maybe like we're over-egging it for many regional people, is a stressful experience when you're well. It certainly isn't something that people wish to do at a point in time where they should be considering their families and their friends and staying close to home. I had and I appreciate that the Minister has made has given us the ability to meet with palliative care people working in the state system, but also some of the private partnerships that have been formed as we travel around the state. And we were in Gelton a couple of weeks ago, and we sat down, and that Midwest model is quite exceptional, but it's quite unique. And I don't think that even in some of the areas immediately outside of its catchment area, there is even that level of support. Certainly in the Central Wheatbelt, there are some good people, but when you start talking about the fact that a lot of these people only see that palliative care specialist, the specialist that sort of supports the whole network on the ground, maybe once a month, because that's what they're funded for through WACS, you start to wonder, one, whether it's sustainable for the person that's actually offering the service, because it's a lumpy service to provide, because you can't anticipate when people are going to require a ramp up or ramp down of their services, but there certainly isn't any shortage of it. One of my very closest friends and supporters is the funeral director in Northam, and he's not going out of business anytime soon. So, you know, these palliative care specialists have an ongoing, and I guess as people start to face more complex disease as we live longer, and require palliative care for various other things that maybe we would never have experienced, the challenges are growing exponentially. So we would always say that the question is, how long is a piece of string? How much funding is required? When we put this to the people that are in the services, bearing in mind that they're at the coalface, without question, all of them would say, oh, at least double what they're getting now. Now, you could say that to every public servant, every person that's running a business, everyone that's offering a service, but these people do a lot with very little, and I don't think anyone would begrudge additional funds going into such an important area of our budget, and certainly I think there will be much discussion as we move forward. So creating a better awareness of what palliative care can offer, and how they can access it, educating the people within the system. I'm sure, Minister, you've come across that. There are probably doctors and medical providers that are unaware of some of the services that are available, so it's as much about educating those people in the system as much as the people that require the assistance. That all comes with a fairly hefty budget, and certainly they are the concerns that are being raised with us, and those gaps are real. We have the Cunderdin example, where we negotiated for one of the independent living units that was built surrounding the Cunderdin Primary Healthcare Centre to be assigned to palliative care. And WACS is currently saying that there is no ability for them to provide the services into that unit, despite the fact that that was a very clear intention of the community up front. And I think we're starting to see that in terms of the aged care interaction as well, and some of the lodges that WACS provides services into. Again, there's an interaction between the federal government and the state government's responsibilities, but in some of these communities, WACS is the provider of last resort. You just can't see that there will be big providers coming in and offering the services that WACS have traditionally offered. And more and more they're being told that they're hanging back. They're withdrawing their services to see if a private provider will step in, and that to us is unacceptable for the families that get caught in the middle of that discussion. So they are more and more common stories that we are hearing, Minister, across the board. So I would draw your attention, Minister, to the fact that prior to the budget, we as a party brought to this House a motion, which everybody voted for actually, you supported it. The last time we raised this issue was prior to the budget, and we called on the government to prioritise regional healthcare funding and services, including palliative care, in the current state budget. You and your colleagues voted to support that motion. We are starting to see some real challenges, as I've just outlined, in terms of workforce, in terms of training and incentives, in terms of GP shortages, in terms of investment into hospital and physical infrastructure, and we're starting to see people very distressed and almost at crisis point when they talk to us about this. Nursing shortages, midwifery services diminishing every day, primary health care workers, your urgent care clinic promise yet to be realised, and record ambulance ramping, which impacts patient and volunteer outcomes. I haven't touched on PATS, but I do recall, Minister, that you were all care in opposition in relation to PATS, and we haven't seen any revisiting of the PATS system and how that operates under this government yet, and you're on notice on that front, because that is something that regularly gets raised with us as well. The system, in our mind, is reaching a crisis point, and it is up to the government to step in. Our record in government was good. I can stand here and say that every day of the week. We reset metro and regional health to make sure that you had the ability to capitalise on that when you came to government. What we don't want to see is that good work eroded because your priorities are elsewhere, and we're arguing about the needs to have, not the nice to have, in terms of an essential service for every single person living in regional Western Australia.